Good afternoon and welcome, everyone. Like Jessica said, this is the fourth edition of our Preceptor Development lecture series. Today's topic is student evaluation. Some of the lecture objectives that we're going to talk about today is review the purpose of the preceptor's evaluation, recognize the importance of communication to the student and the program in evaluating student progress, as well as what you can do in identifying that you may have a struggling or difficult student. Let's start. Hold on. I need to make something smaller here so I can see. There we go. The goals of the clinical phase. We're going to back things up a little bit. What is really the goals of the clinical phase? It's to apply didactic knowledge to supervise clinical practice and develop and sharpen clinical problem skills while expanding and developing medical fund of knowledge and perfect the art and history taking and physical examination skills. The goal is also to sharpen and refine oral presentations as well as written documentation skills and develop an understanding of the PA role in the healthcare delivery team. It's also important that the students develop an interpersonal and professional skills that are needed to function as a provider. All right, moving on. Sorry, my computer's a bit possessed today, I think. The role of the preceptor. The preceptor is very much an integral part of the PA curriculum. Preceptors serve as a role model to the student. They also provide guidance and teaching and help students perfect skills in history taking, physical examination, effective communication, physical diagnosis, as well as recording and reporting communications, problem assessment, and plan development, including a logical approach to further studies and therapy. Preceptors also serve as an evaluator for the student's clinical performance, and that's an extremely important role in regards to the final grade of the student in that clinical rotation. Preceptor program relationships. It's very important for us to have a very close relationship with our preceptors. It's the success of the clinical training of the PA students that depends on maintaining good communications among the students, the PA program, preceptors, and clinical coordinating team. Certainly, if a preceptor ever has a question or concern, we encourage them just to pick up the phone and give us a call, and we can certainly help direct you or help remediate any problems that may occur. The problem strives to maintain open relationships with our preceptors and believes that it should problems arise during a rotation, notifying very early on is important. Don't wait until the end of the rotation to let us know that there was a problem with the student so that we can hopefully remediate the problem and then make it a good rotation for the student as well as the preceptor. Please remember that FERPA guidelines also pertain to preceptors, the federal law that protects the privacy of the student in educational records. Make sure that we ensure that clinical evaluations are completed and maintained in a very confidential manner. Information about the student's clinical or academic performance should only be shared with those who have a legitimate educational interest, and that would be the clinical team at either program in Omaha or Phoenix. Clinical instructors are not privy to a student's academic record performance unless it's a direct correlation to the respective clinical instruction. So if you really don't have anything to do with the student, really, there should be no reason why you're looking at any records on the student. But when in doubt, again, please pick up the phone, give us a call, and we can certainly help clarify for you. How do you ensure that this may be a successful rotation for you as well as the student? I think orientations are important. Using that first few days to really orientate the student in regards to what the expectations are. It helps facilitate a quicker transition and establishes a feeling of enthusiasm. And students definitely work more effectively if they know kind of the lay of the land. Step to create a positive experience. I think some of the important ones I've highlighted below. Expectations are key. I've heard numerous times that when talking with students, they just didn't know that that was expected of them. You know, unless that's actually communicated, it's impossible for students to understand that. They're on so many different rotations in so many different locations with different preceptors, and everybody's expectations are a little different. So sitting down with the student, really talk with them in regards to the expectations, not only for clinical care, for how they're going to interact with the patients, and any procedures that they may take part in. You know, basically helping them to understand what you're looking for in an oral presentation, as well as documentation in the EHR, and any assignments that there may be in regards to the clinical rotation that you may provide them during their rotation with you. Expected student progress. You know, students earlier on in their clinical rotations are much different than when they're just about ready to graduate. So I think that the supervision and the autonomy is also a little different when students first start out. You know, students are trained to obtain a detailed history. They perform physical examinations, give oral presentations, and develop differential diagnoses. And as time goes on, that starts to morph into developing more plans and assessments and really educating the patients as well. And we're looking for that progression in our students. As the preceptor feels more comfortable with the student's skills and abilities, the student should be allowed to progressively increase supervised autonomy. Preceptors should also use program defined learning outcomes, opening up that syllabus that we sent you and looking at the rotation learning outcomes and the expectations as they're outlined on the evaluation forms, which you'll receive from us as well. And what is the purpose of evaluating the student? You know, certainly it's a primary mechanism for feedback. Certainly, it's not only for the program to gauge the student's abilities to meet the learning outcomes for the rotation, but also identify the student's strengths and opportunities for growth. I think that's very important. Many times that we focus on kind of what is not going well on the rotation, instead of sometimes focusing on what is really going well and providing that feedback. It's also an element of the final course grade, certainly not the only element of the course grade, but it is a portion of the course grade. So we really take that the evaluating of a student very seriously. Student feedback and evaluation. I think this was discussed at the last presentation, but I'll touch on it again because I think it's an important aspect of preceptor evaluation. The evaluation is process is designed to promote constructive communication, constructive communication between the preceptor and the student, and it's paramount to the student's development. I think unless we communicate with the student in regards to their strengths and their weaknesses, it's impossible for them to improve. So letting them know not only what they're not doing as well, but also letting them know what they're doing really well, and so they can really work on those areas. Feedback should consist of both formative and summative evaluations of the student's progress towards the program's expectations for clinical competency. And we'll talk about that a little bit later in regards to the foundation and how we have built our evaluations. Evaluation of clinical skills and medical knowledge should occur through the following means. Certainly, direct supervision is important. Observation and teaching in clinical settings, direct evaluation of presentations, both oral and written, and any assignments or readings and research to promote further learning. I think it's very important that our students understand the important aspect of self-learning and providing them with assignments in regards to researching a subject and then coming back and discussing that with you the next few days, I think is very important. Preceptor evaluation of the student. You will see two elements of evaluation, the one being a mid-rotation evaluation, and then one at the end of the rotation. The program will provide specific forms for each evaluation. Those will be sent to you electronically through eValue, which is our clinical database, and you can fill those online and send those back to us. We do request prompt completion and return of these forms. The final evaluation is a component of the student's final grade, and I think that's important that they get that back in a timely manner. Ongoing feedback provides ongoing and timely feedback. I think not waiting till the end of the rotation to really talk with a student in regards to their performance, but also talking with them possibly on a daily or weekly basis, sitting down with them, letting them know how they're meeting the expectations that you have provided for them and areas where they can use some improvement. It provides the student with feedback on their strengths or weaknesses, and also the areas and needs that need improvement. There's two types of evaluations. Like I said, there's a mid-rotation evaluation that's required by the program. It basically serves as a formative feedback for the student. It's shorter. It provides just some information in regards to how they're doing up to this point in the rotation, and what they can do to complete the rotation and be successful in that completion of the rotation and get the most they can out of the rotation. The end of the rotation will serve as the summative feedback. It's based on learning objectives and grading rubric, which is set forth by the program. Preceptor should consider performing brief and end-of-rotation evaluations privately with any colleagues, any other physicians or PAs that the student may have worked with during that rotation, to get some insight in regards to their level of professionalism. I think it's also important to talk to your staff and really find out. They are great in regards to eyes and ears of how students are working with the other team members. I think that's very important. Oh, why are we going the wrong way here? Okay, sorry. Evaluation structure. The Omaha PA program has structured their evaluations based on entrustable professional activities, or EPAs. There's 13 EPAs. These were developed by the AAMC, and they are basically descriptors of work. And the goal is competency, and the competency may be at varying levels depending on where they're at on their rotations. And we look for competencies toward the end before they graduate. So they are the framework of the preceptor evaluations. They're also linked to our program outcomes, which we ultimately continually monitor to ensure our students are progressing toward meeting those program outcomes. And as you can see, they're pretty simplistic in regards to activities. Descriptors, EPA 1 is basically gather a history and perform a physical exam. 2 is the differential diagnosing. 3 is the ordering of diagnostic, interpreting of diagnostic studies, discussing and entering prescriptions, and then document a clinical encounter. And that continues on with some of the basic things that students do or we do in our clinical practice on a daily basis. These are our program outcomes. There's 6 of them: patient care, medical knowledge, practice-based learning and improvement, interpersonal and communication skills, professionalism, and systems-based practice. And as you can see, under each one of them, there's not only a definition of what that means, but there's also the EPAs that is linked with in regards to the patient care. So the EPAs support our program outcomes. A Likert scale is what we use in regards to completing the evaluations, 5 being the markedly exceeds expectations, and then 1 being unsatisfactory. And then there's certainly room all in between. Now, I've been a preceptor myself, and I think it's easy if a student is delightful and nice and really friendly, it's easy to give them a 5, but I really want you to step back and look at their performance. Yes, they're kind, they're empathetic, but are they really doing a really, superb job? I think really giving some feedback and providing some feedback in regards to the expectations. And, it's okay to give a 4 and a 3. I think that's perfectly fine depending on their performance. Now, if a student, the students are required to complete all components successfully. If a student receives a 2 or below, which is basically needs improvement, they will need to remediate the learning outcome associated with that. And we will take care of that on our end. So nothing that you need to worry about, but don't be afraid. If there's a reason why the student is not performing well and you feel like they need improvement, I think that's perfectly acceptable to go ahead and choose that, but give it some thought. Certainly comments are certainly welcome and encouraged on all of our evaluations, providing some direct feedback in regards to areas of strengths and weaknesses. This is just a quick excerpt from one of our end of rotation final student evaluation. As you can see on the left there, history and physical exam, but demonstrates the knowledge and skill in performing the components of complete problem-based and focused history. Physical examination appropriate for the family practice setting. Each one of our evaluations are designed to correlate with each specialty in medicine. So you will see a little bit different ones for different rotations depending on the rotation, but this one is for family medicine. And as you can see, the Likert scale is above there. Below there, there would be a box for comments. And then on the right are our entrustable professional activities that correlate with this rotation. prioritizing a differential diagnosis, the diagnostic studies, the prescriptions, documentation, oral presentations, form clinical questions, and retrieve evidence to advance patient care. I think this is really important. That's that self-learning component that we like to reinforce. And recognize a patient requiring emergent or urgent care and indicating the evaluation and management of that. Obtaining informed consent for any tests or procedures, and perform any general procedures that a PA may do. And that may be suturing, maybe incision drainage, it may be anything that a student or a PA may do in practice. Certainly that is what we want to evaluate. So get those students involved as much as you can in regards to the hands-on aspect of general procedures. Oh, lastly, what do you do with a struggling or difficult student? Certainly I think having a candid conversation with the student is important, letting them know that you're concerned that they may be struggling, or if you're just having difficulty with it, maybe a personality clash or whatever it may be, lack of professionalism. The best way to handle that is pick up the phone and call us. The Omaha team is listed on the left there. That'd be Darwin Brown, myself, and Donna Zarnicki, which is our clinical coordinator. And our Phoenix clinical team is Carla and Mary Ann, and those contact information is listed on the right. We will handle that. We may call you and get some additional information in regards to what you're seeing and what you're concerned about, but we will certainly call the student in and work with the student in regards to rectifying that. I think that's all I have for today. It's pretty quick. I think in summary, student evaluations are very important. Giving honest feedback is important in the growth of the student and becoming a very competent provider in the future. Continuing education information is located on this slide. And if you have any questions, please don't hesitate. Reach out to me. I'm more than happy to answer any questions, or reach out to any one of us on the clinical team, whether it be in Omaha or Phoenix. I thank you for your time, and looks like you have a little bit of your afternoon left. So thank you very much and have a great day.